is wealth. Governor OKOWA's Stronger Delta agenda in repositioning the primary healthcare agency in Delta State, a vision on course. The very popular saying, health is wealth, flows from the understanding that good health leads to productivity and better performance. Poor health, on the other hand, leads to expenditures on drugs and treatments, thereby reducing wealth. As the world population grows day by day, the importance of functional healthcare has become one of the top priorities of well-meaning governments. Over the years, a sizable number of societies have paid considerable attention to the improvement of primary healthcare. And this concern has propelled the establishment of centers where essential health is made accessible to individuals in communities at costs they can afford.
Any society where you have health prosperity, there must be economic prosperity in such a community. Health is very critical. It's a very important thing. In fact, every nation should give a highest budget to health. Once you are healthy, every other thing falls in place.
A healthy society or community is a wealthy one. When people are healthy, they are rich. As a matter of fact, if they are not sick or they are able to get medical care, then of course they'll be productive.
In Nigeria, several previous efforts to reposition the healthcare sector have suffered several setbacks, no thanks to poor healthcare infrastructures, lack or inadequate funding, and poor implementation of policies.
In most communities in Nigeria, primary healthcare, they are shut down. Why? Because no nurses, no doctors, no healthcare givers. If government can help with road so that the people in the community can access the primary health care.
The health sector in Nigeria is not working well because inappropriate equipment. Sometimes you can go to health center and they will tell you they don't have this, they don't have that.
Smartdelta.
The formulation and implementation of relevant health policies and programs is one of the 5-point agenda of Governor OKOWA's led administration in Delta State. In the past 5.5 years, the administration has pursued progressive improvement and regular upgrade of health facilities with a view to effectively solving huge health problems that has plagued the sector in Delta State over the years. This particular facility is one of such, and there are many more in the 3 senatorial districts of the state. Mrs. Laura Ade is responsible for the facility management. Let's find out to what extent these facilities promote healthcare. Good day, ma'am.
Good day.
How you doing, ma'am?
Good, thank you.
So you've been here for quite some time. I would like to know what makes you unique and how does it promote the health policies of the OKOWA-led administration?
One of the key points of the Asaba Specialist Hospital is its ability to meet to the needs of trauma patients. We have a fleet of ambulance and a theatre which is very active, well equipped in our A&E section of the hospital. We also have a 9-bedded ICU, well equipped with ventilators to care for high dependency, intensive care patients as well as low dependency. The radiology as well as the laboratory services that is being provided by our private partners help to make the care of patients in ICU of good quality. We also have the physiotherapy unit that cares for patients who've had stroke and any patient that would need rehabilitation. This is run by our private partners, Physio for Africa, currently doing a training, as well as we have professionals that are coming from the United States to help support the service. Our sickle cell center also provides care for the warriors and is well equipped to make sure that patients don't need to travel far to get care.
Okay, let's talk about cost. We know it takes a lot to bring in this equipment into the state. So does it affect the cost of health delivery to the people?
I must say the cost of healthcare is quite reduced. Let's start with something like The number of patients we have seen so far in this hospital is about 55,000. Out of these 55,000 patients, 80% of them come under the Delta State Contributory Health Scheme. And under this scheme, the money they pay is well subsidized. We have the under 5, we've seen about 25,000 of them, and they come in for free. We also have the maternal patients, and we find that they don't pay as well. So when you look at it, almost 80% of these patients are receiving healthcare for little or no cost.
Beyond these facilities, ambulances have been procured to further boost the healthcare delivery in Delta State.
Delta State government, through the Ministry of Health, introduced several people-oriented health programs aimed at not just reducing the disease burden of Deltans, but ensuring that the death rates resulting from preventable diseases and sickness is brought to their barest minimum.
The core song of the Ministry of Health is health for all Deltans. The ministry, in concert with the Primary Healthcare Development Agency, improving, rehabilitating and upgrading primary healthcare facilities. Everyone has access to good healthcare services. We have revamped our emergency ambulance service. Presently, we are overseeing the mass yellow fever vaccination, and we are still on top of target.
You have a governor who is a medical practitioner, an astute politician, and you have a commissioner who is on top of his job. And the agency, the Hospital Management Board, and all other parastatals under the Ministry of Health, they are up and alive and running. So that clearly states why it is easily contained and the casualty or fatality rates are within reasonable limits.
The repositioned Delta State's Primary Healthcare Development Agency, TSPH-CDA, a parastatal of the Ministry of Health, has, through the instrumentality of existing 485 primary healthcare centers across the 3 senatorial districts, continued to cater to the health needs of the people.
Primary healthcare provides services to people where they stay and live. There's primary care center in every ward. So not far from every individual, you have a primary care center that you can access basic healthcare.
In line with the well-established philosophy of prevention being better than cure, the management of the Delta State's Primary Healthcare Agency has maintained the push system for vaccine distribution, and this has led to the successful organization of nothing less than 12 supplemental immunization activities, maternal and child health, rollback malaria, and much more in the last 5 years.
In the States, anything concerning 0 to 5 years is free. So we immunize children, women of childbearing age, pregnant women as well. And you know quite all right that in the state too, there is free antenatal that is going on. Basically, everything about immunization is free.
The exploits recorded in the health sector in Delta State has helped the state to contain the spread of infectious diseases outbreaks like Lassa fever, chicken pox, and many others in recent past. These initiatives have continued to help strengthen the state's preparedness to handle outbreak of diseases.
Governor OKOWA is a medical doctor himself and is bringing that into bear whenever there are any health issues. When we had the issue of COVID, it was activated in the state, and the relevant bodies, agencies were activated and brought together with being coordinated by the state epidemiologists. They swung into action on how to address whatever ailment or disease that comes up.
To further upscale sensitization for immunizations, Governor OKOWA recently flagged off the mass vaccination against yellow fever campaign.
As a government, we will continue committedly to do all that we can to fund all health needs of our people. I'm glad that all is set and everything needed has been provided for the campaign to start. The vaccines, we have been told, are very safe and free, so nobody is paying any money anywhere to be able to get the vaccination.
I am happy that the Delta State government is giving us this vaccine for free. It will help to prevent yellow fever disease and it will prevent deaths.
Dr. Grace Ngozi Orofuke, State Immunization Officer, Ozwem Onyeka, Juliet Adoro spoke to Smartdelta Media about the development.
We are training over 1,346 participants that qualify health workers. We have the nurses, the CHOs, and the CHOs. The LGA team is here as well. They're supporting us. The National Primary Health Care has been with us all the way.
We are going for vaccination because of the outbreak. For the state to have taken this kind of step, it means the governor really cares about the people.
It's part of our job to help educate the community on the various disease and their vaccine. A lot of people are not aware of it, but this exercise that is going on will help them become aware of what is going on in the community.
Our team followed up to various camps and settlements to witness the vaccination process. We spoke to Okolo Anthony, Medical Officer, Health, Anyocha North Local Government Area, alongside other staff, as they explained the various procedures taken to ensure the effective delivery of the vaccination and success recorded so far.
The state government, headed by Senator Dr. Ato Ifani OKOWA, has directed the State Primary Care Development Agency to come with logistics, vaccines and other supplies to collaborate with the local mental health authority to be able to make sure that the vaccination takes place.
This vaccine is for all ages. People between the ages of 9 months and 44 years are the people we grade as youths, and apparently sometime in their lifetime they may not have taken, but those above 44 years, because we know that this vaccine is one dose, gives lifelong immunity. They are not immune to the disease, but we know that they may have had the vaccine.
It's better safe than sorry. I would like to thank the governor of Delta State for this initiative.
Smartdelta.
Fayo! Now soap, I've been a white head in your head.
Monasco! Fayo, you know say yellow fever dey. Why you open body?
Oh, but na cool breeze I dey take. Why I take concern yellow fever now?
You know say na one kind mosquito dey cause this yellow fever. Now I make this OKOWA administration. They encourage everybody to dey vaccinated. Make we also dey wear clothes wey go protect us from mosquito bite. See, make we dey sleep under mosquito protective net, and every stagnant water make we clear and comot. Make we dey cover every container wey water dey.
Monet, may we go front go sit down. I no wan stand too much because for some days now I dey feel feverish, body pain. I dey feel headache.
Oga Monem, abeg, na wetin be the symptoms of this yellow fever? Because I no wan fall sick o.
Na some of the symptoms na you mention so, and yellowness of the eyes, dark urine. If the case don worse, bleeding from nose, mouth and ear.
Stay protected against yellow fever.
Monet, my wear my shirt.
Get vaccinated.
Hospitals across the state were designated and positioned to manage patients who develop symptoms and complications to ensure that Delta State is rid of this disease. Dr. Gloria Patrick, Director, Primary Research and Statistics, PHCDA, in a chat with Smartdelta Media, spoke on the success they have recorded so far.
The SMART agenda, his focus was two things, basically. First is to get healthcare to Delta through the Delta State Contributory Health Scheme. The second is to revitalize primary healthcare. And that has also gone on to the second tenure, which is, of course, developing a stronger Delta. Having this basic healthcare provision fund, it being achieved in Delta State, that's also because of his support. So we'll have more resources to work.
The commitment of the governor to foster wider health coverage without digging too deep into the finances of the masses propelled the establishment of the Contributory Health Commission, which up to date has been able to provide prepaid health services to over 890,000 registered enrollees.
The equity plan captures those group of people that can affect your health indices. Also included in this equity plan, the elderly, the physically challenged, the mentally challenged, the free maternal, and it's a comprehensive package. So far, the response has been great.
We'll continue to thank the governor, who himself has a medical man, particularly for this insurance-based healthcare provision. He is the pioneer governor in this regard. We thank him. We are going to own up this place and protect it.
This policy over time is gradually tackling the rise in the cost of healthcare services. It is important to stress that the maternal and child health components of the health insurance scheme had continued to attract accolades to the OKOWA-led administration.
It's necessary to ensure that the child from 0 to 5 years, the parents have no money. It's treating it free. We call the equity group. From the day you are pregnant till the day you deliver, either by cesarean section, you won't pay a kobo, either for antenatal care nor for the surgery, if you happen to have surgery. His Excellency the Governor, through the government, is paying for it.
In a bid to reduce infant and maternal mortality, expectant women are catered for from antenatal to post-delivery. As such, both pregnant and new mothers have expressed gratitude to the state government for lifting the financial burden off them and also providing quality and tangible services in various centers. Hear them.
Ever since when I got my first daughter, I've been coming here for treatment. They have treated us free, giving us free drugs.
I'm very grateful, especially if I'm going to hospital. I'm now know that I'm not going to pay anything. I love our governor. He's doing very well.
On a visit to the primary health facility at Owelogo, Isoko North, the Smartdelta team met with beneficiaries who narrated testimonies of free healthcare services.
They invite us here to take treatment for my daughter, and I'm still pregnant. What I will say is that Dr. OKOWA is trying, and we also pray that God will bless him.
The nurses, they take care of us very well, and the nurses will give me drugs free. In fact, I'm short of words, but for me, I say the government, God will bless them and reward them.
Justina Ogenovo, the matron in charge of the primary health center, explains further the wide-ranging support received from the state government.
Before, we used to be just myself as a nurse and a health assistant, but now we have about 8 workers. A pregnant woman comes for antenatal. We do registration fee. We're free. Then we give them the required drugs which that person is supposed to take, the pregnant woman, and these drugs are given free. Apart from the free medical treatment, salaries are paid as at when due.
Next, we headed to Agbaroto Primary Healthcare Center, Ughelli North, where we met Mercy Philip, who just put to bed, and others. These women testify to enjoying free healthcare services that have lessened their financial burden.
I always come here for free treatment before I give birth today. And when I give birth, they do not collect any money from me. Everything is free. I want to also thank God for OKOWA, for the things that you have been doing to Delta State as a whole.
I'm happy. Charlie, I came in this morning to register in Agbara Healthcare Center. The nurses, the matron, they are attending to everybody here. Well, okay, no partiality, and we didn't pay any money.
The Commissioner for Health, Delta State, Dr. Modi Ononye, in an interview explained the level of success the state has achieved so far through the partnership and support from WHO, UNICEF, Caritas Nigeria, Association for Family and Reproductive Health, Catholic Relief Services, and many more, who have worked to ensure that tangible services and quality inputs are delivered to the good people of Delta State.
There's a lot of collaboration we want to with UNICEF. They are doing quite a lot. Also, the WHO is doing a lot in the state. Of course, the Global Fund, our partners, also takes The state is counterpart role for you to experience successes in this area. We are working harmoniously with these partners, and that is why we're having success in the field.
Collaboration and integration, the key principles of primary health care. The governor and even the governor's wife, they've done a lot in terms of health, taking health to Deltans. And that's why we're even happy. That's why we're also saying that we collaborate. The government cannot do it alone.
Anxiety related, so we should expect it during this campaign.
Dr. Onyinye Emefiene, a representative of WHO working in the state, attested to the high level of the commitment showed by the state government through the support given so far. According to her, Delta State is ranking top among many other states in the country when it comes to fighting against outbreaks.
I must commend Delta State. It's one of the first states that has carried the torch of the Basic Healthcare Provision Fund. It's been great working with the Delta State Primary Healthcare Development Agency. I mean, it's all about primary healthcare, starting from the grassroots, ensuring that health gets to all.
A clear understanding of the importance of having authentic and quality medicaments has propelled the Delta State government to continue to run its drug revolving fund to ensure the regular supply of essential drugs to health facilities across the state. Pharmacist Ifoman Double, Fund Manager, Drug Revolving Fund, DRF, explains more.
The Delta State Revolving Fund, we have laid so much emphasis on safety and efficacy of the drugs that is being distributed to all the government health facilities. We have a quality control laboratory for which any product, any medication that is administered orally or through the vein are analyzed at our quality control laboratory, in addition to the NAFDAC registration.
Not too long ago, Governor Ifeanyi OKOWA was recognized by the Nigeria Association of Resident Doctors, NARD, for pioneering the implementation of the residency training program in Nigeria. The award is in recognition of the commitment by the Delta State government to set the pace in the delivery of affordable and quality health care.
Despite the challenges to finances in the state, I believe that we'll continue to do the best that we can so that we can provide a conducive learning environment for our resident doctors.
Governor OKOWA's exemplary and leadership qualities evidenced in the state has further earned him several awards, and most recently the prestigious ZIGS Award. Deltans and Nigerians, by extension, re-echo that this is well deserving.
On behalf of the board, we present this award of congratulations.
Governor OKOWA stands out as one of the governors that, despite the hardship that we faced in the country this year, has still been able to judiciously utilize the resources of the state in delivering on the mandate of Deltans.
I believe he's a decent man, and he has worked very hard to turn around the fortunes of Delta State. Azuka getting the award for leadership in the corporate world.
It's not the first award that he's receiving. He has received so many awards. Right now, the prestigious ZIGS Award is the height of the award that one can receive. Receiving an award in good governance, that speaks volume.
Raising the bar of healthcare in Delta State is one vision Senator OKOWA is passionate about. These revolutionary remarks were achievable through resilience, determination, and the willpower to deliver health and prosperity to all Deltans through the Stronger Delta agenda. The feedback segment. Question of the day.
I really want to know, please, is there any kind of side effects or maybe complications associated with its yellow fever vaccine that is ongoing? Because for me, I'm really scared.
Thank you, Timothy Josephine, for that question. Common side effects of yellow fever vaccine may occur, okay, 5 to 10 days after being vaccinated. Usually those involved in vaccination exercise usually know what to do. They tell the mothers of the children what to do to be able to take care of these common side effects, etc. So it's really not much of a problem. There are a lot of cases where there may not even be side effects at all. Okay.
It's important to get informed about what is going on in this state. If you're going to pass suggestions to us as government, your suggestions will be welcome. To know more about the Smart Delta team, follow Smart Delta on their various links.
Text your questions to 09016652274 or send with the hashtag #AXIT to all our social media platforms.
You better run, come to Delta State. Come and see the good things where OKOWA they do. You better run, come to Delta State. Come and see the good things where OKOWA they do. I see your job and work creation in Delta, make the youth say them highlight. OKOWA. I see good roads everywhere in Delta, make the people say them cola. Come live in Delta. Say me I say. Come invest in Delta. Come explore the potentials of our state.